A pharmacist working in retail pharmacy plays a crucial role when it comes to patient care and medication safety. They are not only the medication experts, but they are an essential part of the retail pharmacy workflow. Retail pharmacy consists of many different moving parts to ensure patients receive accurate and safe medication. In order for a patient to receive their medication, it must first make its way through each station within retail pharmacy. These different tasks are overseen by the pharmacist to ensure that each and every patient receives accurate and effective patient care. First, the prescription is dropped off at the pharmacy. This can be done physically by the patient with a handwritten prescription, sent over through an e-prescription, over the telephone, or by fax. Prescription information such as medication name, strength, quantity, directions, and refills are then all entered into the patient's profile. Once the information is entered and looks correct, the label can be printed and it is ready for product dispensing. Once the prescription has made it through data entry, it is now ready for product dispensing. Typically, this process is completed by pharmacy technicians and interns, although this can be done by pharmacists as well. No matter who performs at the station, it is typically done by matching the product to the label and preparing the medication as it is written on the label. Although there is more to this process when it comes to controlled substance prescriptions. For Schedule II prescriptions, a perpetual inventory must be maintained. Once the product is dispensed, it is ready to be sent to the pharmacist for final verification. Verification is the most crucial step for pharmacists, as this station cannot be done by anyone other than the pharmacist. First, the pharmacist must verify the data entered into the system compared to the prescription to ensure accuracy. The pharmacist should then verify that the product is the same as the medication on the prescription. In the verification stage of the process, this is when a prospective drug utilization review will be performed. This is conducted by the pharmacist before each new prescription to ensure patient safety. This review identifies therapeutic duplication, drug-disease contraindication, drug-drug interaction, and much more. These are then presented to the pharmacist for review and verification. If there are problems with the prescription or the product dispensed, the pharmacist is responsible for catching these errors. Once the verification is complete, the prescription then makes its way to point of sale and is ready to be picked up by the patient. Point of sale is the area within the pharmacy where patients come to pick up their medication. The last station before the medication reaches the patient can be done by any member of the pharmacy staff. Typically, a patient will come to the counter and confirm their name and date of birth with one of the pharmacy staff. They will then do one last final check to verify that the name on the prescription matches the name provided by the patient. The patient is then checked out at the register. This is also where any member of the pharmacy staff can offer counseling regarding the patient's prescription. Although any member of the staff can offer counseling, only the pharmacist and the pharmacy intern can perform the act of counseling. The pharmacist should provide counseling on each new drug therapy that is deemed significant by the pharmacist. The pharmacist should also provide a designated consultation area where the counseling can take place. In addition to counseling, pharmacists also provide other clinical services to their patients. Immunizations are a clinical service provided by pharmacists in retail pharmacy. Patients are provided with a questionnaire that is reviewed by the pharmacist, and the immunization is then administered by the pharmacist, pharmacy intern, or certified pharmacy technician. Another clinical service provided by retail pharmacy is point-of-care testing and screening. Pharmacists can conduct or interpret point-of-care testing for their patients. This service done by the pharmacist can assist patient with further healthcare assessments. As the role of the pharmacist advances, these responsibilities may change or expand, and the stations of retail pharmacy may differ. Overall, pharmacists play a critical role in ensuring medication safety and patient care by overseeing each station of the retail pharmacy workflow.